Hi, my name is Terry Harris of Harris Biomedical in Seattle. And every year we do between 1,000 and 1,200 hazard assessments in dental offices, and that's an effort to help them understand what they need to do to get into compliance. And a very common issue that we see in a dental office is the failure by the clinical staff to wear appropriate personal protective equipment throughout the entire dental procedure. And in our view, the dental procedure starts when the patient sits down, and it ends once they get the patient instruments in through the sterilization process. And the basic rule for personal protective equipment in the bloodborne pathogen standard is that if there's a reasonable likelihood that you're going to get blood or saliva on your skin or your clothing, you must wear personal protective equipment. And in the chairside scenario, staff is religious about that. Rarely do we see anything of significance in terms of not wearing personal protective equipment. Sometimes we'll have to tell them, you know, push your glasses up or put the mask over the bridge of your nose. But other than that, they're very, very close to what is required. What happens though is after the procedure, and I can understand this, where they've been wearing the mask for for an hour or so, and the patient leaves, when it comes time to break the room down, then we will see people, the staff people, disinfecting the room as they're supposed to, and not wearing appropriate personal protective equipment. They might still have the same dirty gloves on that they had in the procedure. They very often will not wear a mask when they're spraying the disinfectant. They very often will not wear eye protection. They'll have their lab coat on or their scrubs on, but if they are not wearing the appropriate personal protective equipment when they're spraying and they're inhaling or ingesting the disinfectant, what they're basically doing is ingesting or inhaling not just a disinfectant, but a pesticide. They're classified basically the same. They have the same job description: kill the living organism. How many of you, I really wonder, will go into an operatory without a mask and without eye protection with a can of Raid, press the button and stand there? And yet you do the very same thing very often. So the message is, when you're breaking the room down, wear appropriate personal protective equipment, meaning appropriate to the potential hazard that you're in the middle of during that. And then also remember that when you go into the sterilization area, wear the personal protective equipment there as well. If you do that, you can save yourself a lot of grief and a lot of potential harm in terms of your health downstream.